Rick Rage. I'm the CEO of Bichette Pathology and Stark Medical Auditing. And today I want to give you an update of some of the things we're seeing and maybe to answer some of the questions we received over the last couple of weeks. First and foremost, modern healthcare. Great article in here about lab company to settle $12 million kickback allegations. There was a $43 million one in April 2020. 2019, $42.6 million. November 2019, $26.7 million. It never ceases to amaze me the number of people that think they can simply go out there and buy lab tests and have them sent to their lab. The OIG's all over this. Time and time again, they catch these things and they punish people. And it's interesting, as in our work, we do a lot of work with labs around the nation, and we hear this, we get this phone call quite often about people wanting to start a lab and how they're going to get work, and this is one of the questions we have to help address. So if you have questions about that, how you're getting your work, if you're not getting it in a way that you feel that's correct, maybe talk to some legal people about it. Don't end up on modern healthcare. Don't end up as in the news in the negative light. Some of the things we're seeing as we move forward, interesting things lately. The one thing we saw that came out of, I think a week and a half ago, said that inpatient Medicare patients for COVID-19, the payment will be boosted 20% as of September 1st. Now, as part of this move, what CMS is saying is, it doesn't mean if the patient is admitted for COVID, it just says if the patient is positive for COVID. So you can come in for a knee surgery, test positive for COVID, and then get the 20% boost. But they will be auditing these inpatient claims, and if they find, for example, that the patient doesn't have a positive COVID test in the record, they can recoup the money back. We're seeing a lot of angles around COVID right now, a lot of payment issues, a lot of denial issues, a lot of people thought they would be paid for their COVID testing, that's not getting paid COVID testing. We're having a problem with portals. If you have questions with your COVID billing and your COVID recovery, your revenue, give us a call. We don't do billing, but we're the ones that audit, and we're the ones that help solve those problems going forward. And then another one I want to talk to you about is some of the things we're seeing on our audit side. It's important that you continue to audit and look at your denials and appeals going forward. In a recent instance, we identified a Medicare payer that paid below a Medicaid payer that paid below the state Medicaid rates, and these cases were supposed to be appealed. And what we found is that this Medicaid provider, it was a commercial Medicaid program, paid 50% of the Medicaid rate, and the biller never caught it and never appealed it. So again, they brought us in because their money was down, and they said, what's wrong? And we found, by doing an audit, we found a bunch of Medicaid claims that simply weren't appealed, and we were able to help them put some money back in their pocket. The last thing on the note here is healthcare. How's healthcare doing overall? The great note, I follow Healthcare Finance. They came out and said hospital operating margins are down 92% since July of last year, but this doesn't include the CARES money that they got. So even with the aid, however, operating margins are down 28% year over year, January through July 2019. So 28% is a big number. It's hard to run any business if you're losing 28% of your revenue. So we're not done seeing the change. We're not done seeing how things will be affected going forward. But we know right now COVID has left a big divot in healthcare revenue for a lot of people. All right, some questions and answers. Here's one of the questions that came in. We recently learned that UHC is justifying its 88305 prostate biopsy takebacks for Medicare Advantage members by stating that their policy for G0416 was in place since 2015. What we're finding is UHC is going back and recouping money that were billed for prostate biopsies, even though they paid for them for the last 5 years. And the question is, why are they just now deciding to enforce this policy that came into effect in 2015? It's 5 years later. Well, my thought is this, and from what I know with payers, I've talked to many payers. I've actually looked at working for some of the payers when I was younger. I understand that the insights very well there. What I think happened is when it came to pathology you're a small part of the budget. So these payers are profit driven. They have to show 5% revenue every year to make their shareholders happy. And when they do that, everyone's good. And what they do is they work their way down the list. They start off saying, hey, look, we have this kind of damage here, this kind of damage here. They call it leakage. And they finally got to this prostate leakage, and they're going to tighten it up. That's exactly what they're going to do, and it's going to be troublesome, and you're going to see some takebacks on this. I would argue that you can't retroactively recruit money, and I would make sure there was something in your contract to do that, and I would pay very close attention to your next contract for anything like this. We do a lot of managed care negotiations, so we fight this battle all the time. Next question. The Trump administration and HHS is continuing to push hospital price transparency in a bid to offer more information to customers. What are some of the potential drawbacks you see that hospitals have in their advocacy that make their hospitals and their advocacy organizations reluctant to sign? Do you believe consumers will actually benefit from policy? Will consumers benefit from a hospital price transparency problem? No, absolutely not. Most people won't even go there and look. It's kind of like the CDC website. The CDC website has all this great information on COVID, but people don't get their information from the CDC. They get their information from Facebook or Twitter or CNN. And when it comes to transparency, maybe 1 out of 100 patients will actually look and see what their knee surgery costs before they go to a hospital. Most people will take exactly what their physician says and say they'll follow that forward. Their doctor says go to this hospital, they'll go to that hospital. If the doctor has meeting privileges at that site, they'll go to that site. So what will happen though, if we make all these things transparent, it'll really cause managed care to drive down, insurance companies to drive down their payment, because if everyone knows what the lowest common denominator is, then everyone will be bidding at that rate. It'll make hospitals' job much harder to negotiate, and it'll make revenue probably 5% revenue cut over across the board for health systems. So it won't be pretty. I think this is a bad idea by the administration. I don't see where anybody wins here other than the insurance companies. Next, CMS recently announced an interim rule clarifying that labs that fail to report COVID-19 test results and demographic data to HHS within 24 hours of results being known may face penalties of $1,000 a day and $500 for each subsequent day they are found to be in violation. Considering how difficult of time many labs are having gathering data points such as race and ethnicity, do you expect CMS to widely utilize its power to impose these rules? Remember, a month or so back, CMS said, hey, we have to know the race, ethnicity, all these things on patients that we're testing COVID on, which is something labs never did. They never tracked that kind of stuff on their requisitions, and now they had to change the requisitions and ask for this stuff. And now CMS says you have to report this stuff within 24 hours. It's not happening. Most labs can't do this. They're struggling to get it done. They're struggling to get the information out, and they're struggling to get the information out. And I guarantee you, if I audited 100 claims from 100 labs, we'd probably find a 30% error rate, because most labs are struggling to get the information and getting it out there. So will CMS penalize these groups? I think there might be 1 or 2 come maybe November, December as an example to say, hey, we're going to put these people up on a pedestal and make an example out of them. But when you look at some of the other things that are going on, for example, Michigan, the state of Michigan still hasn't reported their nursing home COVID numbers yet, which they were supposed to report back in April and May. And the state of Michigan hasn't been punished for that. So I wouldn't hold your breath. I would make my best effort. If I was a lab, I would show where I'm gathering this information to the best of my ability, and I'm sure where I'm trying to report it to the best of my ability, with the understanding that it won't be 100% complete. A couple more questions. In fact, let's make this the last question, because it's a pretty deep question, and I want to go into it. While it initially seemed Congress would move to pass a second sweeping stimulus package this fall, those discussions appear to be on hold. Do you believe another round of stimulus is necessary to keep healthcare system afloat, or has it stabilized to a point where additional money will be necessary? Interesting question. Thank you very much for the question. Please feel free to send in your questions if you have them. It depends how we go forward. Consider this. There will be a flu season this fall. COVID-19 will wane, and there'll be a new flu. There'll be COVID-20, whatever you want to call it. That every year the flu season kills 30 to 70,000 people a year. It's been every year. How we react to that will be interesting. Will we go back into lockdown? Will we make everyone wear a mask everywhere all the time? Will we consider these 30 to 70,000 deaths an anomaly and that we have to prevent them? And do we cut down elective surgeries to do that? How will the government react going forward? I can tell you this as a business owner. If you cut down businesses to 50% of their revenue again for 3 to 4 months, you're going to see a catastrophic failure of businesses across the states. Many places, like in Ohio, Michigan, for instance, where we're at, restaurants are still at 50% capacity. They can't be open past a certain time. They can't hire people because people are still getting $600 a week on unemployment. I mean, I was just at a place up north, and they had to close because they can't find anybody to work because they're making $2,400 a month not working. Can we keep going forward like this forever? Absolutely not. There will be catastrophic outcomes. If we close elective surgeries again this fall, we will see catastrophic failures in the healthcare system. We will see more and more consolidation. And we will see services change from what they used to be to what they will be going forward. Perhaps timing will be longer for surgeries. Perhaps outcomes physical outcomes will be the same, but the care treatment path might take longer. We're going to see changes. It will happen. The other thing we really got to ask ourselves as healthcare businessmen is, how do we handle the $4 trillion that was dumped into the budget? How do we not end up with huge inflation? How do we not end up with the Fed raising the inflation rate and us all paying 11 or 12%, for loans going forward? If in 3 years the average loan rate, instead of being 4%, is 12%, you're going to see a lot less innovation in healthcare. You're going to see a lot less growth. People won't take the risk on a 12% dollar versus a 4% dollar. And the last thing is, in a recent Forbes article, they said 45% of small businesses noted themselves as moderately negatively impacted by COVID. So this is them saying, hey, we're already stressed. If we close everything down again this fall for the flu season, whatever we call it, COVID-20 or whatever we call it, how will that impact the economy going forward? Will we have to print more stimulus money? Will we have to do another PPP round? That's going to be really, really interesting. I think we're already going to see this divot in a healthcare revenue going forward. Remember the COVID curve? We built projections for our clients. It's going to be a while. Like one of my friends is an airline pilot. He said it's going to be 2 years before the airlines come back. If we take another 3 months off, we might write a lot more businesses goodbye, and that would be a difficult thing to face. Well, I'm Mick Raich. I'm the CEO of Bichette Pathology and Stark Medical Auditing. I'd be happy to take your questions and answer them. If you have any questions about COVID billing, or about your revenue side, you want someone to audit, look at things, because remember, we're finding right now that billing stopped in April, May, and it's train wrecking right now. We're seeing it across the board. Give us a call. Give me a call. My number will be included in the video. I'll do my best to help you out. Thanks for the day. Take care.